Hi all, today we are going to learn about one of the regressive alterations of the tooth, that is abfraction, in more detailed way. Abfraction is known as the loss of both enamel and dentin due to biomechanical loading of forces. It is postulated that these lesions were caused by flexure of tooth during loading, leading to fatigue of enamel and dentin at a location away from the point of loading. That is, when we have the occlusal masticatory forces which will result in the flexure of enamel and dentin of the teeth. The fatigue of the enamel and dentin over a period of time will cause breakage of the tooth. So when there is a force applied over the occlusal area, there is a reaction that is happening at the cervical end of the tooth, that is the abfraction. The term abfraction is given by Grippo in the year 1991, and the word abfraction is derived from a Latin word which means to break away. The lesions due to abfractions are also called as cervical stress lesion in some literatures. Now let's see the etiological factors that are the reasons for abfraction, which is malocclusion, any faulty restoration, prosthesis on the opposing teeth, and bruxism or parafunctional habits. All these etiological factors will result in excessive cyclic and eccentric forces, which will turn as microflexion at the cervical region, where, as shown in the image, when the occlusal forces are being loaded there will be microflexion seen at an cervical region. So this will result in cyclic alternating tensile and compressive stresses, resulting in more concentration of the stresses at the cemento-enamel junction, which is a point away from the occlusal area. So as a result, as a direct effect, the stress will cause the hydroxyapatite crystals bonds to be broken and will cause the tooth structure loss, and as an indirect effect it will become very weak, so later on it is more susceptible to get fractured. Clinical features are: the site where the lesion appears is mostly on the buccal surface of the teeth at the gingival third region, and the shape is wedge or V-shaped. It is actually classified by Smith and Knight index as scoring given from 0 to 4 based on the depth of the lesion. So 0 is no change in the contour. As seen in the first picture, there is no change in the contour, and the score 1 is minimal loss of the contour at the cemento-enamel junction, and score 2 is the defect where the depth of the lesion is 0.1 mm of depth, and 3 is the lesion of depth 1 to 2 mm, and the score 4 is given for the defect where the depth of the lesion is greater than 2 mm or pulpal exposure or exposure of the secondary dentin is seen. Then coming to the treatment, we should first treat the etiology. If the etiology is the malocclusion or faulty restoration, we should correct them. If it is due to some prosthetic rehabilitation, we should check for the high points on the prosthesis, or if it is due to bruxism or parafunctional habits like it, then we should go with the occlusal spins for them. Abrasion and abfraction has to be differentiated, where abrasion where multiple tooths are involved and it is caused due to improper brushing technique, and abfraction involves only single tooth. As we see in this video, this is how abfraction occurs. When there is an increase in occlusal force, masticatory force, at the point away from the occlusal area at the cemento-enamel junction, there is a breakage of tooth. Thank you all.